But as our guest explains, the problem runs deeper than just the latest news. Let's talk now to Dr. Shondra Loggins Clay. She's assistant professor in the College of Health and Human Services at Northern Illinois University. Dr. Clay, thank you so much for joining us.
Thank you for having me.
Doctor, it's still for some surprising that at this stage of the fight in this pandemic that people of color are still reticent to do this.
Yes, absolutely. And, to some extent, we have all probably been hesitant about the vaccine because there is so much unknown about COVID-19 still, especially with the new findings with Johnson & Johnson. But really the conversation of vaccine hesitancy in communities of color is just a great introduction to some of the larger context issues that we see in our healthcare system today, such as inequities in healthcare and also health disparities in health outcomes.
So what are you saying to people who are very hesitant and say, hey, I'm not going to do it no matter what, even though they're seeing people doing it in droves?
That's a great question. I think the message first has to be about it's a personal choice. Do your own research, use reliable sources such as the CDC's website or asking a medical expert who you can build rapport with or who you have this rapport with, and look within yourself and say, what is it? What is this something that I want to do? And what are my reasons for doing it? And then you make an informed decision. I also think that from a governmental level, we have to make sure that we do not force trust on communities of color, specifically like the Black community. We must work on addressing some of the structural barriers that we have caused the mistrust within the Black community.
Yeah, the Tuskegee experiment, the Henrietta Lacks, things like that caused the distrust in the first place.
Absolutely. And I'll be remiss if I didn't mention the Tuskegee study. Mm-hmm. It has definitely caused mistrust. But again, we have to look at also the broader context of where are the sources of these health disparities in healthcare outcomes.
So right now, with folks looking at you now who are on the fence, what do you say to them?
I would say that I have a salient identity. I am African American, and I am also a research scientist, an expert, assistant professor. I would say that, again, do your research. It's a personal decision, but also I would encourage them to really just think about that this vaccine can potentially save your life or the life of a loved one.
All right, Dr. Clay, thank you so much. Be safe, be well.
Thank you.
All right.